Hello friends, welcome to Wizac-Medical Concepts Simplified. In this video, we will learn about electrocardiogram or ECG. ECG is a graphical representation of the electrical activity of the heart. Cardiac muscles are known for their automaticity, that is, they generate the impulse by themselves. This impulse is primarily generated because of exchange of cations and anions across the cardiac cell membranes. As this is a continuous rhythmic cycle, at any given instance, half of the cardiac cells are positively charged and other half are negatively charged, giving rise to a voltage difference, thus creating a dipole-like situation. This voltage difference creates depolarization and repolarization of the cardiac cells. Since this depolarization and repolarization waves have specific direction and magnitude, they can be represented as vectors. The vector moving towards the positive side is reflected as an upward deflection, whereas the vector moving towards the negative side gives a downward deflection in the ECG. The impulse starts at the SA node, also called as the pacemaker of the heart. This is then conducted down to the AV node, also called as the gatekeeper of the heart. Through this, the impulse travels down to the bundle of His and finally to the Purkinje fibers. This gives rise to various waveforms of ECG known as P wave, QRS complex, ST segment, J point, T wave and U wave. P wave represents atrial depolarization or atrial contraction phase. QRS complex represents ventricular depolarization or ventricular contraction phase. T wave represents ventricular repolarization phase, whereas U wave represents repolarization phase of Purkinje fibers. ECG is usually recorded on a graph paper containing 1 mm square grid-like boxes. Each small box measures 40 milliseconds of time interval, whereas each large box containing 5 small boxes measures 200 milliseconds of time interval. This time interval is very important in differentiating normal waveforms from the abnormal ones. ECG paper runs at a speed of 25 mm per second and has a voltage of 10 mm, that is 1 millivolt. ECG is recorded through ECG machine which is connected to patients via leads. Standard ECG is a 12-lead ECG of which there are 6 precordial leads, that is from V1 to V6, or the chest leads, and 6 limb leads, that is L1, L2, L3, AVR, AVL and AVF. The limb lead records the vertical or frontal activity of the heart, whereas the chest leads record the horizontal activity of the heart. The combination of various chest leads and limb leads reflects the various areas of the heart and thus show us the site of myocardial injury. For example, V1 and V2 represents the septal area of the heart or the anteroseptal area of the heart. V3 and V4 represents the anterior area of the heart. Lead 1, AVL, V5 and V6 represents the lateral area of the heart, whereas Lead 2, Lead 3 and AVF represents the inferior area of the heart. Before jumping on to ECG interpretation, we should first know how a normal ECG looks like. A normal ECG usually consists of a sinus rhythm, that is P waves are present before every QRS complex, and it has some calibration values which are as follows. Voltage is 1 millivolt or 10 small boxes. Speed of the paper is 25 mm per second. L1 is usually upwards or towards the positive side, whereas AVR is usually downwards or towards the negative side, but this may be inverted in case of dextrocardia. These calibration values are very important as the changes in it can have a misinterpretation in the ECG. Now let's have a look at some normal ECG values. P wave is usually less than 120 milliseconds or less than 3 small boxes. PR interval is usually between 120 to 200 milliseconds or 3 to 5 small boxes. QRS complex is less than 120 milliseconds or less than 3 small boxes, whereas QT interval is 450 milliseconds in males, whereas 460 milliseconds in females, that is approximately 11 boxes. Normal heart rate is between 60 to 100 per minute. Normal ECG axis value is between -30 to +100. Axis deviation of less than 30 degree is labeled as left axis deviation, whereas axis deviation of more than 100 is labeled as right axis deviation. ST segment elevation or depression is usually labeled if the ST segment is raised or depressed by more than 0.2 millivolts in males and more than 0.15 millivolts in females from the isoelectric point. So friends, this brings us to the end of this topic. Hope you like this information valuable and applicable in your clinical practice. Please do like and share this video and hit the bell icon for latest updates. Do check our Instagram and Facebook handles for more clinical insights. And for more such informational videos on medical topics, please subscribe to YouTube channel Health Wizac Medical Concepts Simplified. Thank you.